weekdays at 3 on Local 3.
If you were watching us this morning and perhaps you've been dealing with some pain in your legs, maybe you're noticing a wound on your leg that's not healing quite as quickly as you think it should, you could be dealing with venous insufficiency. This is Dr. Timothy Klepper. He is with the Vein Company. Good to see you.
Good to see you again.
So you were here a while back and we did talk a little bit about what venous insufficiency is, venous insufficiency. I'd love to do a bit of a recap.
Sure.
But today we're going to then take a positive spin on it because you can tell us how you address it. It is fixable.
Exactly. So venous insufficiency or venous hypertension or venous reflux is when the two main veins in your leg, the greater saphenous vein that kind of goes from your groin down to your ankle, and then from your knee to your heel, the valves in there don't work right. So what happens when you walk, the muscle contracts, squeezes the blood up to your heart, and all that blood would fall back to your foot if it weren't for valves that are in your veins. So when those valves don't work right, what happens is you have what we call reflux, or that blood flowing back down towards your foot, and that leads to a lot of pressure down in the lower part of your foot. It can actually be 10 times greater when these valves don't work. And so the term venous hypertension comes into play because of that. And because the valves aren't working right, another phrase for it is venous insufficiency.
Okay.
And so people that have this often have heavy legs, aching legs, tired legs, and some of them will even have something called restless legs. There are a lot of patients who are being treated with medicine that actually have venous insufficiency, and the venous insufficiency is what's causing the restless legs.
So let's pause on a couple of things because I do want to get into the treatment side of things. I imagine that like so much in life, the earlier intervention you get, the better your results. So on the restless leg, what does that look like? Is that a nighttime only event?
Not necessarily. You may just feel like you always have to move your legs. You can't keep them still. You have to either flex your legs or walk. You just feel like they have to be moved in order for them to be comfortable.
Okay. Is it a tingling feeling or is it
It can be. More of it's just feeling that they have to move. A lot of times there's aching that's associated with it, and you're just feeling comfortable. A lot of people will get that occasionally when they're sitting for a long period of time, but a lot of patients describe that when they're sleeping they can't keep their legs still, and a lot of times their partner will let them know that it's really a problem in the middle of the night.
On the pain in your leg when you walk, do people sometimes, is walking a good thing, or should you try to keep your feet up more?
Keeping your feet up is good, but walking contracts the muscle and helps push the blood up. So walking is good. It's prolonged standing that's a problem. So people have an occupation where they're standing for a long period of time or sitting for a long period of time can cause back flow and pressure and cause problems with their valves.
Okay, so now let's get to the treatment part of it because you do have to live your life.
Right.
So that's where you step in.
Right. When I was a general surgeon many years ago, the treatment for this was very invasive. We actually did what was called a vein stripping, where we went in surgically and removed the vein. And the irony of that was it actually doesn't work as well as the treatment that we have now, which is much more conservative, much more minimal. So all we have to do now is put a catheter in the vein. We enter as low below the knee as we can. We insert a catheter, and then we do one of two things. We either cauterize it or we fill it with a medical adhesive. And both of them work really well. The advantage of the medical adhesive is that you don't have to wear those compression socks afterwards. So it works by filling the vein and basically closing it up right away. The cautery works by causing the vein to scar down. And so in order for that scarring process to complete itself, you have to wear compression socks for about 10 days afterwards to help that process.
Does this affect people of all ages, or is it something that tends to happen as we get older?
It does affect younger people more than people realize, but a majority of people are older than 40, which some people...
That's not old.
No, I don't think so either.
Get out of here, Dr. Klepper. Okay, now you mentioned the sitting, because standing is something we know.
Right.
But what's that catchphrase that sitting is the new smoking?
Okay.
Right? Have you
heard
heard that?
one, but no.
We have that quoted here quite often, but we
Okay.
are more sedentary than we used to be.
Yes, and that can definitely contribute to venous insufficiency, as well as pregnancy and being female, there are some hormonal changes, and hereditary. So if you've had a parent who's had varicose veins or venous insufficiency, or you've been pregnant, then you're much more likely to develop venous insufficiency.
Does shoe choice play a role?
Not so much.
Okay.
It's more whether you're walking.
Okay, it's lifestyle.
Or lifestyle
Okay.
is more of a.
So let's say that someone's watching and they're thinking, okay, you know what, I've been noticing that my legs are tiring more frequently, or there is this spot on my shin and I can't get it to heal up. Maybe this is what I have. Make an appointment with you and then you guide from there?
Right. The way I got into this was patients that I had ulcers that wouldn't heal, and a lot of these are due to venous insufficiency. And we've had patients who've been to wound clinics for literally years, and if you fix the problem, which is a venous insufficiency, then these wounds heal up within a matter of weeks. It can be life-changing.
They're focused on that, and that pretty much exclusively, the health of your veins is their business at the Vein Company. You'll find them on Jarnigan Road right here in Chattanooga and East Brainerd. 708-5050 is the phone number. Online, theveincompany.com. His name, Dr. Timothy Klepper. Great to see you this morning.
Thank you.
Get your tickets now for Heartstrings for Hope. Dustin Lynch, Randy Houser, George Burge, and Jackson Dean will join songwriter Kelly Lovelace for an intimate concert, all to benefit the children of St. Jude. Get your tickets at us101country.com now.
My name is Vicki, and I called